People have been drinking coffee for many centuries. It is one of the most popular beverages in the world, and there has been much debate over the years about how beneficial or harmful coffee is for the body. We asked a familiar gastroenterologist about this, and here's what he said. Just a few years ago, a patient who would have asked such a question during a medical appointment would have received a definitive answer. Stop drinking coffee, it is harmful. However, the results of recent studies have given us new information about the impact of coffee on human health. Annually, around 1 billion kilograms of coffee beans are produced and consumed worldwide. The leading coffee bean producing countries are Brazil, Colombia, and Vietnam, which are the largest producers. Although there are currently about 500 different types of coffee known in the world, two of them, Arabica and Robusta, are the most widespread globally. It is known that after roasting, coffee beans contain up to 1,000 biologically active substances, and, depending on the type of coffee, the methods of preparation, and the method of production, for example, instant or ground coffee, not only the taste of the coffee beverage changes, but also its impact and effect on the body. The effect of coffee on the body is primarily determined by caffeine, as well as some other substances, for example, antioxidants. The well-known stimulating effect of coffee is caused by the competition of caffeine with the substance adenosine for special receptors in the body. Adenosine, by binding to receptors in the central nervous system, has a calming effect, which promotes relaxation and sleep. Caffeine, by blocking these receptors and preventing the binding of adenosine, hinders its calming action. As a result, a person experiences an increase in activity and alertness, as caffeine maintains a state of wakefulness, counteracting the action of adenosine. Moreover, caffeine has other effects. For example, it causes the contraction of arterial vessels, except for the vessels of the kidneys, which, on the contrary, relax and expand and slightly increases blood pressure. As a gastroenterologist, I find it interesting to note the effect of caffeine on the organs of the gastrointestinal tract. It is known that caffeine can cause contraction of the gallbladder, enhance bile secretion, stimulate the motility of the large and small intestine, and cause increased synthesis of hydrochloric acid by stomach cells. As for the studies on whether coffee is harmful or beneficial, in 2012, the results of a decade-long study conducted in European countries regarding the impact of coffee on human health were published. It encompassed about 500,000 participants and unequivocally showed that individuals who consumed 3 or more cups of coffee per day had a lower mortality rate from any diseases compared to those who did not drink coffee. A similar study was completed in 2017 in the USA and showed similar results. Individuals who drank coffee were less likely to die from cardiovascular diseases, cancerous diseases, and digestive system diseases. In the same year, an analysis of a large number of clinical studies was also conducted, which showed that individuals consuming 3 or more cups of coffee per day significantly less often had cardiovascular diseases, including ischemic disease, digestive organs diseases, and strokes. Moreover, according to clinical studies, the risk of hypertensive disease, that is, increased blood pressure, was neither higher nor lower, regardless of how much coffee a person consumed. There are also study data regarding the protective effect of coffee on cancerous diseases, and a significant effect was shown in relation to prostate cancer, skin cancer, and liver tumors. It is known that coffee can affect the course of certain diseases. For instance, it was shown that consuming coffee reduced the risk of liver steatosis by 30%, as well as decreased the risk of fibrosis and liver cirrhosis. Consumption of 2 to 6 cups of coffee reduced the likelihood of developing gallstone disease. We know that some patients with gastroesophageal reflux disease may note the appearance of heartburn after consuming coffee. However, according to studies, the risk of developing gastroesophageal reflux disease itself, or heartburn as a symptom, did not increase in individuals who consumed coffee, regardless of the amount of coffee people drank during the day. Nevertheless, we know that a number of patients suffering from gastrointestinal diseases, particularly diseases of the stomach, gallbladder, and intestines, may note the appearance or exacerbation of certain symptoms, for example, diarrhea, nausea, or abdominal pain, after consuming coffee. Apparently, This is related to the same stimulating effect of caffeine on the digestive organs. Doctors can recommend patients either to reduce the amount of coffee consumed per day or to change the time of coffee consumption, say, after meals. If these recommendations do not help, it would probably be logical to advise quitting coffee altogether if it has such a negative, undesirable effect on the symptoms of the disease. Additionally, there is a restriction on the consumption of coffee by pregnant women. It is recommended to consume coffee in a volume that does not exceed 100 milligrams of caffeine per day. Less is better, as a larger dose increases, and sometimes significantly, the likelihood of problems with the fetus or miscarriage. Thus, at the present time, according to data from a considerable number of studies on large groups of people, we cannot speak of the overall negative impact of coffee. Rather, in relation to diseases, coffee seems to have a positive, protective effect, some positive action. Nevertheless, in some individuals, particularly those with poor tolerance to coffee, some symptoms may occur, specifically pain and bowel disturbances. Doctors decide individually whether a patient can consume coffee or should abstain from it altogether. In conclusion, I would like to make a remark regarding the studies themselves, following which, as I mentioned earlier, the main method of collecting information about the amount of coffee, the number of cups of coffee, was merely a survey of participants. Accordingly, each respondent had their own perception of what their cup of coffee looked like in size, and exactly what kind of coffee was in their cup. It should be said that in most cases, these studies were not talking about instant coffee, but about ground, brewed coffee. That is all for now. For more information on this topic, check out our channel. Subscribe and hit the bell for all notifications. Please like and share this video with your friends. Thanks to our sponsors for their support. I eagerly await your comments and encourage you to watch these useful videos.